Nicholas, thank you very much for having accepted to meet me for our interview. I'm very pleased to welcome you to Italy, even if not physical. We can see that you are working, so I will try not to steal too much of your time.
I appreciate that.
So, Nicholas, the first time we met, it was because Rizzola Hospital has bought Excelsius GPS. And today, you know that we have two Excelsius GPS. So the first question is, how do you feel knowing that the same hospital gives this second amazing platform to its surgeons?
Obviously, that's very exciting. And the reality is that it also shows us how adoption happens. And what I've said all along is that if you get exposed to the technology and then you start using it, you don't want to go backwards. So what happens at your beautiful hospital is that you had one of the first in Europe to get this technology. And then what? Everybody at the hospital says, well, I want to use it too. And we're seeing this now across the United States as well, where here at Johns Hopkins, we have two robots. NYU has six robots. And we see that as the adoption increases by an institution, that they understand that they need to have more bandwidth. So I think it's a testament to the fact that the adoption occurs certainly when there's a nucleus of activity. So when the surgeons at one hospital start using it, the other surgeons say, well, I want to use it too. And that's how things get busy. Now, from a hospital that doesn't have it at all, somebody has to be the person to be the trailblazer, to do something different, to try something new. But it sounds like you are already on your way, and it's very exciting to see that develop, especially in Europe, where we are always understanding that everybody has cost considerations, everybody has this, but if there must be a value, right? If the hospital is making an investment for two devices, there has to be a value to the patients and outcomes, a value to the surgeon to standardize the procedure, and value to the hospital for maybe doing more cases safely. So I think it's a testament to how things are going, which is very exciting to see.
Thank you so much, Nicholas. Let's see the point of view of the surgeons. Years ago, when we met, you said that the most experienced, the more experienced surgeons shouldn't be afraid of this innovation because first of all, it was a good opportunity to deliver a standard good clinical result. So it involved mostly young surgeons or not very well experienced surgeons. What happened during the years? Something new, I think, that we can now share in terms of usage that Excelsius GPS has shown to be used for.
I think as we see what's happening now, the adoption. So the younger generation, very excited. They are very facile with technology. The younger surgeons, the residents, just out of training, they understand the value of technology as an assistant. What I've always said too is some of the older surgeons realize I don't need it. I'm very good at what I do. I think when we look at the data about how good anybody thinks they are, we realize that not everybody is good as they think they are, and we can always be better. And I think that the safe usage of enabling technology makes us better. The other interesting thing that we're finding now, especially for the older surgeons, is ergonomics. And as a surgeon, we have only a limited time to be able to do what we do. If you're an attorney or if you're somebody, an author, or you might be able to do work until you're 80 or 90. But as a surgeon, we have a limited life expectancy. And what I'm seeing now is a few things. One, with the adoption of technology like robotics, we are seeing decreased cognitive load. I'm not stressing about the part of the surgery where I need to be perfect with putting the screws in. And we're also seeing ergonomically, if we put the screws in with power, we're saving surgeons' shoulders, we're saving their neck, we're being able to have them in a more neutral position. So I have had many, many older surgeons come to me and said, I'm using the robot, 5 more years I have of my career that I wouldn't have had without the robot because it's so much easier to do the surgery.
It's a very great also measured impact that robotics is giving to the community, to the professionals. Nicholas, it's an honor to have the chance to speak with you about education. Johns Hopkins, your long career. We will have during our event Professor Cardari, Professor Angelini, who deal every day with young surgeons and people that want to base their future on education. Which is the perfect package you would describe for not only a young surgeon, but a surgeon, a spine surgeon that can feel relief with the education?
I think, obviously I've spent my entire life training residents, training fellows, training neurosurgeons on various techniques and technologies. And one of the interesting things is in neurosurgery and orthopedics, we don't have as much time with the resident as we used to have. So, for instance, in neurosurgery, the specialty has become so complicated. We have vascular surgery, we have functional surgery, peripheral nerve surgery, brain tumors, all these things. And the reality is that that decreases the amount of time we have to spend. So, where I may have spent hours and hours as a resident doing spine surgery, we have less time. How do you make up for that? Well, technology can help make up for that. The thing I will say from an education standpoint is the most important thing is the patient. The most important thing is understanding the patient, understanding the disease process of what you're treating, but also really understanding the anatomy. So every single patient is different, anatomy is different. And one of the criticisms I hear as well, you're doing the surgery robotically, the resident's not learning the anatomy. You have to know the anatomy. You have to understand the trajectory that you're going in. You have to understand it's a different way of doing things. And one of the examples I give is gallbladder surgery. 40 years ago, we used to make a big incision and to look at the liver to take the gallbladder out. Now we make two incisions and we put an endoscope in. And the surgeons thought, oh, no, nobody will ever do that. Well, now everybody does that. There isn't any more gallbladder that's done where we make a big incision. Everybody has endoscopy. And I think we're going to see that. Finally, I'm convinced of that with the robot and technology because of the residents and education. So I think it's an opportunity to teach in a different way. So we're not anymore doing a big open surgery where we're having to take all the muscle and everything else. We're doing things smaller, but you still have to know the anatomy, understand the patient and the pathology.
Thank you, Nicholas. Augmented reality. We can stay within the educational sphere, or for many is also a great opportunity for the spine surgery. Which is your point, your belief?
So I think it has two possibilities. There's no doubt that it will be used in education. I mean, the resident can put the goggles on and practice the surgery, see the anatomy. So that will be helpful. But I'm now 100% convinced that it will be in the operating room on a daily basis with image guidance, with robotics, to have the surgeon immersed in the operation and not be distracted. One of the problems is that as we're doing surgery, we're looking back and forth, we get distracted. Being able to focus our attention, understanding, seeing through the patient, having feedback about what's happening, and then having that registered, the physical world registered with what I'm seeing, that's going to change everything. So, well, for sure, it will be an educational. I firmly believe that it will be in the operating room as part of what we do for spine surgery, for brain surgery, for general surgery, for everything. I think that will be the next step in surgery is to have that ability to see in a different way and to do in a different way.
We have here, when we are going to broadcast the interview, several surgeons that perform hundreds of operations per year with robotics. Massimo is one of these, Federico is one of these. I would like to make them a gift because we will do their presentation, and I do know that your picture is at the slide number 1. Tell them, Massimo and to Federico, something that moved you when you started to think years ago that robotics or cobotics could be an opportunity for the entire community worldwide? Massimo and Federico.
Listen, I was very excited when both Massimo and Federico started adopting this technology. And why is that? If you can take a master surgeon, an Italian surgeon, who the Italians, like the Greeks, the birthplace of civilization, and introduce a technology that gets adopted by them, that means something. Because these are both surgeons who are very talented, understand what they do, very busy. For them to adopt it, for me, is very humbling and it's a point of personal pride. But the reality is that when they see value in it, they also are telegraphing that their usage is important for other surgeons as well. So both Massimo and Federico, I'm very excited that they have become early adopters, and not just early adopters, but now master surgeons in robotics. They were master surgeons before, they're now taking it to the next level, utilizing enabling technology. That's what's very exciting.
Thank you so much, Nicolas. The last message is for the mayor of the city that supported with pleasure the event and wanted to be witness of this advancement in technological adoption and searching for new opportunities. How do you see the world and the cooperation with the institution? Why it's so important that health system goes out of the hospital and that institutions know more about technical, even innovative solutions?
Yeah, I think this is what's exciting is that we're not now just dealing with the patient and the surgeon. That ecosystem is happening already. I think what's happening in Italy and in your town is something bigger. What we're seeing is not just an adoption of technology, but we're seeing a renaissance of the usage of this type of technology. That has to be supported. The Renaissance didn't happen with Michelangelo. It happened with Michelangelo and all the people that supported him, the benefactors like the mayor, the benefactors like the hospital that enable us to do what we do. Everybody has to be doing the same thing. And as we do that, the new renaissance of technology, enabling technology and robotics is here. And just as you were the birthplace of the Renaissance, again, now we see Italy becoming the birthplace, the Renaissance of surgery.
And Nicolas, before greeting you, I want to thank you because you gave us the opportunity to use one of your picture.
Thank you. I posed for that last week, and you've done a very nice job. I appreciate that.
Thank you so much. So thank you, and I wish you to have an amazing day in the US this morning. Here is afternoon. We will be happy to welcome you in Italy whenever you want.
Thank you, Antonio. My pleasure. It's such a great pleasure to see you, and good luck on the event. I'm sorry that I couldn't go. I will be there next time.
Thank you so much. Good luck, Nicolas. Thank
Have
you.
a good day.